External features of the heart. Hello everyone. Today we are going to learn about the external features of the heart in a simple and easy way. So let's begin. The heart is a muscular, hollow organ. It is enclosed in the pericardium and lies in the middle mediastinum, resting on the diaphragm. About 2/3 of the heart lies to the left of the midline. Now let's talk about the shape and size of the heart. The heart has a conical shape, like a pyramid, with its base at the top and its apex at the bottom. In size, it is approximately equal to the fist of its owner, and the weight of the heart is about 250 to 350 grams. Now let's move towards the surfaces of the heart. The heart has 3 surfaces. First is the sternocostal, or anterior surface. Second is the diaphragmatic, or inferior surface. And third is the pulmonary, or left surface. Now let's discuss the borders, or margins of the heart. The right border is formed mainly by the right atrium. The left border is formed mainly by the left ventricle. The inferior border is formed mainly by the right ventricle, with a small part of the left ventricle, and the superior border is formed mainly by the left atrium. The great vessels are separated from the left atrium by the transverse pericardial sinus. Now let's talk about the grooves, also called sulci, of the heart. The first one is the coronary or atrioventricular sulcus. It encircles the heart between the atria and ventricles and contains coronary vessels, nerves, and lymphatics. The second is the anterior interventricular sulcus. It lies on the anterior surface between the right and left ventricles. It contains the Eledit, great cardiac vein, and accompanying nerves. The third is the posterior interventricular sulcus. It lies on the posterior surface between the ventricles. It contains the posterior interventricular artery, middle cardiac vein, and nerves. Now let's move to the pericardial reflections. The serous pericardium is reflected onto the great vessels. It is reflected onto the aorta, the pulmonary artery, the superior and inferior vena cava, and the pulmonary veins. Now, there is a simple mnemonic to remember the position of the base and apex. Base behind, apex ahead. This means that the base lies posteriorly and to the right, while the apex points forward, downward, and to the left. Also, the base of the heart is formed mainly by the left atrium, and the apex is formed by the left ventricle. The apex beat is felt in the 5th left intercostal space, just medial to the midclavicular line. So let's quickly remember the key points. The heart lies in the middle mediastinum. About 2/3 of the heart lies to the left of the midline. The apex is formed by the left ventricle. The base is formed mainly by the left atrium, and the apex beat is felt in the 5th left intercostal space. So that's all about the external features of the heart.